As we continue recovering from the COVID-19 pandemic and its toll, mixed with more major public events happening recently and increased calls for service, paramedics in Toronto telling City News there could be a crisis in staffing if things don't change.
Current state of the service, I would say we're definitely in a major thunderstorm and probably headed for a Category 5 hurricane.
Toronto Paramedics Unit Union Head Mike Merriman not mincing words when asked about the state of the service right now.
I can tell you in the paramedic community, Toronto is not the most desirable place to work for some obvious reasons. The call volume is extremely high. The workload is probably the highest in the province. Paramedics are going 12, 13, 14 hours a day without even being able to get a lunch break or to get breaks.
Sentiment City News has heard privately from paramedic sources. Feeding into the concerns, he says, is Toronto's high cost of living, forcing paramedics to live farther away and drive longer, throw in burnout from COVID-19, an increase in reports of assaults against crews.
I'm very concerned that we're not going to be able to attract any medics, and also about retaining them. We're probably having a resignation roughly at least once a week.
But another issue is at play too. Pandemic restrictions impacted the ability to fully train up hundreds of new paramedics at colleges, which means occasionally redirecting medics who do community programs into stations to respond to 911 calls, along with asking workers to do more.
There's daily overtime every day if you want it. You can have overtime day or night. You can have overtime, but they're exhausted. I mean, and a service shouldn't have to rely on overtime to run.
Relief is on the way, though. A new class of paramedics just marked their graduation, and some of the 200 expected to join the service. 140 of those positions will be replacing retired employees or those who quit, while 60 positions are new.
Have we seen a reduction in the number of applicants? Yes, we have. We still had close to 500 applicants in our recruitment this year.
Toronto Paramedics Deputy Chief Jennifer Shield echoing concerns about difficulties students face catching up and graduating college, something that could take up to a couple years to correct. Also, well-known delays offloading patients at hospitals still a problem as medics can spend hours waiting there, causing strain on the roads.
The last 2 years have been particularly difficult with the pandemic. And, just to say up front, really proud of our staff because they really have gone above and beyond in the last 2 years, but it's taken its toll.
While Merriman says the service is not a bad employer, competing forces and cheaper costs of living elsewhere are profoundly impacting Toronto's situation. He's calling on the provincial government to do more to fix things.
It's only a matter of time before somebody's going to die needlessly waiting on an ambulance.
For more on this issue, head to citynews.ca. In Toronto, Nick Westoll, City News.